अस्सलाम वालेकुम। डॉक्टर हुसैन बशकोलाची यूट्यूब चैनल से आज हम आपसे मुखातिब हैं and we are just talking from the Dr. Hussain Bashkolachi YouTube channel, and main purpose of today's talk is give you a kind of information which is related to the community medicine subject, and the topic is iceberg phenomena of the disease, which is very common topic and discussed many times in many examinations, and it is also applied on the prevention of community medicine, public health, and the healthcare delivery system. I hope the students of MBBS, BDS, and even any public health or medical field, they must know what is iceberg phenomena of the disease. It compares the diseases with the iceberg or the uh, ice mountain, which is built in the oceans and in the glaciers, particularly in the oceans or in cold weathers in the rivers. The small portion is visible, the large portion is submerged or hidden in the water. Same, you can see that when you put ice in the glass, then a small portion appears and you can see it, but a large portion is submerged or is uh, in the water, are not visible. The same thing is with the diseases, they are not visible. Most of the diseases, they are hidden in the community, means community acts are equals, or it is a similarity between the community and the water where diseases are hidden, and small portion is reporting to the physicians or healthcare providers. So this was the background, and later I should share the presentation so that we can understand in a better way. So iceberg phenomena of the disease is one of the important concepts, as I have already told, that this is a very common question also in the in many examinations. So I hope the you will understand that this kind of phenomena is uh, I am just trying to share, and and you can see that the iceberg phenomena, and I have Professor Hussein Bashkolachi, a professor public health and community medicine in one of the private university, and before it I was teacher, medical teacher in public sector universities of Jamshoro, University of Hyderabad, and I have also exposure to visit the health delivery system and hospitals in China and India. So let us start, and you can see the my YouTube channel, Dr. Hussain Bashkolachi 6343, and WhatsApp channel is Community Medicine Oblique Public Health. So you can access me, and this video will be uploaded soon. So the objective of the lectures are to describe phenomena of iceberg in relation to diseases in community medicine and to apply iceberg phenomena to symptomatic cases presenting to physician, and third to understand role of screening and secondary prevention if it is a spelling mistake prevention. Okay. So from this picture, you can understand that this is blue iceberg mountain or iceberg. You can say that a huge ice is hidden in the ocean, and a small portion, which is whitish portion, is visible to the naked eye. So vast and small, you can understand. The same is with the diseases, visible cases of the diseases, either they are clinical cases or they are the patients who have died in the hospitals. Then there are invisible cases, inapparent infections or very latent infection or hidden infection, and visible cases also with minor symptoms or no symptoms. So people don't, even the carriers are there, they don't have symptoms, but they carry the germs. This is the same thing which you can see that the invisible cases mostly are carrier and asymptomatic infection, and death and clinical cases are already there. This will give you more apparent view, the tip or the top part of the iceberg, which is at the surface or above the surface, and submerged or below the surface, hidden portion. You can see almost 70% are hidden, and only 30, and sometimes it is the 15% which are going to the clinician side. So subclinical diseases and clinical diseases. So this is one of the areas where you can say that uh, we have this kind of phenomena. And after this, you can see that uh, these are the cases which epidemiologist will see, and the clinician will see the tip of the iceberg. Hidden portion will see the epidemiologist. Screening is done for hidden portion because apparently healthy people are quick, safe, and result oriented are sensitive are ideal diagnostic test, quick test applied on the healthy people. So diagnosis is done for the tip of the iceberg. After this, you can see more apparent that the tip is symptomatic and the submerged are either carrier or asymptomatic, and you can see the clear difference that a small portion is reporting, the major portion is not reporting. And then we can have this MCQ, which one of the following does not represent the submerged portion of the iceberg. So the diagnosed cases is the correct answer, and all other options are not correct because carriers are pre-symptomatic and undiagnosed cases are not shown. And here you can see that there are at least four diseases where the iceberg phenomena will not be applied. And you can see that are rabies, tetanus, measles, and rubella because they are so apparent. So, with this, I think we are ending this, but before that, you must learn what is disease, what is impairment, what is disability, what is handicap. These are called a spectrum of the disease. We will have a separate video on this. So, with this, I think once again you will understand that iceberg phenomena of the disease is very important concept, and in short time I have explained, and I think the student of MBBS, student of MPH, MPhil, MCPS will understand better. And if you have learned something good or your knowledge has improved, please drop in the comments box and like it, share it with your colleagues, students, and thank you very much once again. Thank you.